today we will talk about explanation and interpretation of the respiratory function test. We'll talk about the spirometry. This is a common question in the MRCP part 1 or part 2. Here is the question. 60 years old gentleman presented with dyspnea. As part of his investigation, he underwent full pulmonary function test. He will give you the vital capacity, the forced expiratory volume, the first, second, and residual volume, and the total lung capacity, also diffusion capacity and diffusion coefficient. To solve this kind of questions, you should know about the spirometry, and in this tool, the patient is taking a deep inspiration and is trying to do a forced maximum expiration. It is supposed that the air is to be exhaled more than 80% in 6 seconds, and in the first second it is supposed to exhale more than 80%. You can see that this is the diagram which shows the total lung capacity. The total lung capacity, it equals to the vital capacity plus the residual volume. So the vital capacity is the amount of air exhaled after deep inspiration. يبقى بعد ما تطلع كل الهواء دوت هيتبقى لك small amount of air, which is the residual volume, and its function to maintain the patency of the alveoli to prevent it from the collapse. The tidal volume is a normal amount of air in and out, and as we said, the vital capacity is the total amount of air that is exhaled after deep inspiration. It is supposed in the first second to exhale 80 or 75% of all the amount of air. This is the flow volume loop of the respiratory function test, and this will explain to us the pattern of respiratory function test. First of all, you should know that the normal flow volume loop is a triangle over a semicircle. The triangle represents the expiration and the semicircle represents the inspiration. In obstructive pattern, the expiratory limb is affected because expiration is a passive process. It depends on the patency of the respiratory passages. On the other hand, inspiration is an active process, and any disorder that will affect the inspiratory process, it will result on affection also of the expiratory process, and this what occurs in restrictive pattern. So in obstructive pattern, the forced expiratory volume the first second will be affected, and it will be less than 70%, and this occurs with COPD and bronchial asthma, also bronchiolitis obliterans, which is a common complication in rheumatoid arthritis and systemic lupus erythematosus. So the overall ratio of the forced expiratory volume the first second upon the vital capacity will decrease, because the forced expiratory volume second will decrease and the vital capacity will remain normal. But in restrictive pattern, the vital capacity will decrease, and as a result, the respiratory process will also decrease. So the forced expiratory volume the first second will also decrease. So the overall ratio will be normal or it will increase. The causes of restrictive pattern: pulmonary causes, any disruption of the alveolo-capillary membrane like in fibrosis, and pleural disease, and other conditions which is extrapulmonary, such as neuromuscular disorders, skeletal disorders. Also, if there is a painful condition to the chest, like chest trauma or herpes zoster or severe pneumonia, كل ده بيعمل restrictive pattern. So restrictive pattern can be divided into pulmonary causes, which is the pulmonary fibrosis, and extrapulmonary causes, which is the obesity or trauma or skeletal or musculo-neural junction, neuromuscular junction. So we will repeat: obstructive lung disease, forced expiratory volume in the first second significantly reduced, vital capacity reduced or normal, so the overall ratio were reduced. In bronchial asthma, COPD, bronchitis, and bronchiolitis obliterans. Restrictive lung disease, the forced expiratory volume in the first second will decrease, and the vital capacity will significantly reduce more than the forced expiratory volume in the first second, so the overall ratio may be normal or increased. So we will divide it into pulmonary and extrapulmonary. And here come the rule of gas transfer, the diffusion capacity. Diffusion capacity will decrease. It depends on the alveolo-capillary membrane, also level of hemoglobin, and the presence of shunt. Also, in any condition that will affect the inspiratory process. So any restrictive pattern will result in decrease in the gas transfer. So after we do the diffusion capacity, we will do the diffusion coefficient. And the diffusion coefficient is the correction of the diffusion capacity in relation to the alveolar volume. What I mean that patient with kyphoscoliosis or with neuromuscular junction disorder, it will result in restrictive pattern, and as a result it will affect the diffusion capacity. But the alveolo-capillary membrane is not affected in this condition. So when we correct the diffusion capacity with the diffusion coefficient, it will result in increase the value of the diffusion in relation to the alveolar volume. If not corrected, so the condition is pulmonary fibrosis, pulmonary restrictive pattern. If corrected, this is an extrapulmonary restrictive pattern. So the causes of decreased diffusion capacity with increased diffusion coefficient is the pleural disease, chest wall disease, respiratory muscle weakness like Guillain-Barré and myasthenia gravis, and also skeletal deformity like kyphoscoliosis. In all these conditions, there is no affection of the alveolo-capillary membrane. So the diffusion capacity will be corrected in the diffusion coefficient, so the diffusion coefficient will increase. Okay, let's return to the question. So to solve this question, first of all, the vital capacity is 61% of the predicted. There is reduction in the vital capacity. The forced expiratory volume is also reduced. It is 64% of the predicted. So there is reduction of the forced expiratory volume in the first second, but not as the reduction in the vital capacity. So the overall ratio is increased. the total lung capacity is decreased. So we are talking here about restrictive pattern. The cause of restrictive pattern may be pulmonary or extrapulmonary. The diffusion coefficient is decreased from the predicted, and when we correct it to the alveolar volume, which is the key CO, it means the diffusion coefficient, it reaches 94%. So here we are talking about extrapulmonary restrictive pattern, and the only cause here is obesity. So the answer of this question is obesity. And thank you.